Tonight, 5 News digging deeper into a newly released Arkansas Department of Health report that shows more than 200 cases of whooping cough reported this year.
5 News reporter Kayla Davis is here. Kayla, that's nearly 5 times as many cases by this time last year. What's behind the surge?
Alexandra Darren, ADH actually told me today there could be multiple reasons why we're seeing this surge, including vaccine exemptions. But Dr. Naveen Patil says it's important to note the amount of cases we're seeing right now is on track with pre-pandemic levels, as nationwide social distancing slowed the spread of many common diseases back then, and a lack of resources during COVID-19 also prevented officials from getting accurate counts. Pertussis, more commonly known as whooping cough, has early symptoms similar to the common cold in the first 1 to 2 weeks, but will eventually cause persistent coughing fits for up to 10 weeks. The disease is spread through coughing and sneezing while in close contact with other people. Young infants, pregnant people, and immunodeficient adults are especially susceptible to experiencing severe symptoms.
One of the major causes or reasons that we see whooping cough proliferate is unvaccinated populations. And so when we have folks that have not completed the vaccination series, that can be an issue.
Vaccines start for children at a very young age. For adults, Dr. Lance Faddis says it's best to get a booster every 10 years or so.
If you have another pertussis vaccination during your pregnancy, it's also recommended if you're going to be caring for children less than 6 months old that you have an extra pertussis vaccination.
ADH says more than 30 counties across the state have reported at least one case. Most of the cases are in school-age children or teenagers.
This follows national trends. The number of cases in the U.S. is actually more than 5 or 6-fold, and it's the similar trend here within Arkansas. Last year we were around 40 cases, so we have more than 5 times number of cases. In the U.S. last year there were about 4,000 cases, and this year it's almost 25,000 cases.
Once infected with whooping, you can be ridden with a cough for months. It is curable with an antibiotic to help stop the spread, but if you're thinking you're experiencing those symptoms, be sure to visit your local healthcare provider. Kayla Davis, 5 News.